Good afternoon, dear colleagues and guests. Today is the 3rd of November, 2021. It's 3 p.m. Moscow time. Let me declare open a session of the Dissertation Council for the Defense of Thesis by Mamedov, Ibragim, Gamidulayevich for the degree of Candidate of Medical Sciences, Scientific Specialty 140203, Public Health and Healthcare, on the theme Scientific Justification of Medical and Social Assessment of the Health of Male Workers of Shipbuilding and Ship Repair Enterprises. By the order of the Academic Secretary, St. Petersburg University, Gamidulayevich Alexander Valentinovich, dated the 19th of August, 2021, number 8135/1 Akulin Igor Mikhailovich, Doctor of Medicine, Head of the Department of Healthcare Organization and Medical Law of St. Petersburg University, was appointed Chairman of this Dissertation Council. Other members of the Council were appointed with the same order. Let me introduce them to you. Lyndon Bratton Alexander Leonidovich, Doctor of Medicine, Head of the Research Division, Economic Research in the Public Healthcare System, Semashko National Research Institute of Public Health. Savina Nadezhda Valerievna, Doctor of Medicine, Professor, Head of the Department of Public Health and Healthcare, General Hygiene and Bioethics of Amosov Northeastern Federal University. In the remote access mode, at the Dissertation Council session, we have Mirolenko Olga Vasilievna, Doctor of Medicine, Associate Professor, Department of Healthcare Organization, Medical Law, St. Petersburg University. Olga Vasilievna, can you hear us? Olga Vasilievna, can you see? Please say yes. Can you hear us? Please turn the microphone on. Can you hear us? Can you hear us? Can you see us? There is no voice. We can't hear you. Microphone is on the left. We can't hear your voice, Olga Vasilievna. I beg your pardon. So you can see and hear us, is that right? Olga Vasilievna, yes, I can see and hear everything. Yeah, that's what I wanted to hear. Thank you. Meshkov Dmitry Olegovich, Doctor of Medicine, Acting Head of the Public Health Management Laboratory, Trapenzikov Institute of Management Problems of Russian Academy of Sciences. Dmitry Olegovich, can you see and hear us? Yes. Grzybowski Andrei Myeczyslavovich, Doctor of Medicine, PhD, Professor, Kazakh National University, Kazakhstan. Can you see and hear us, Andrei Myeczyslavovich? Good afternoon, dear colleagues. Yes, I can see and hear you very well. The degree applicant, Mamedov Ibragim Gamidulayevich, is also present. Also, at this session, we have the applicant's academic supervisor, Doctor of Medicine, Professor, Head of the Department of Health, Economics and Management, Faculty of Postgraduate Education, Astrakhan State Medical University, Shapovalova Marina Alexandrovna. To improve the communication quality, dear colleagues working in the remote access mode, please switch your microphones off. But please remember to turn them on when you're given the floor. Let me also inform you that our session is being recorded and broadcast live at St. Petersburg University website. These speeches are being simultaneously translated from Russian into English or from English into Russian. During the live broadcast of the Dissertation Council session, at the moment, an email is currently displayed. to which, during this session, all the listeners may send questions to the applicant or their opinions regarding the content of the thesis and the applicant's presentation, the current scientific discussion, and thus take part in this scientific discussion. These questions shall be forwarded to me by our technical support department, and I shall present them during our discussion. Questions should be related strictly to the applicant's speech and the content of his thesis. It's necessary to indicate the name, employment, and position of the author. Questions not related to the scientific discussion of the thesis, its text and assessment, as well as anonymous questions shall not be presented. In accordance with the order of awarding at St. Petersburg University academic degree of Candidate of Sciences and Doctor of Sciences approved by the local regulations of St. Petersburg University, hereinafter referred to as the order, a session of the Decision Council shall be considered competent if at least 2/3 of the approved members are present, but not less than 4 persons. Our council consists of 6 members. All 6 are present, including 3 council members in the remote interactive mode. Audio and visual contact has been established with them. Thus, we have the quorum. I invite the Dissertation Council Activity Support Department Officer to draw up the attendance list. All is well. Let me set forth the following procedure of today's session of the Dissertation Council with approximate duration of 2 hours. First, summary report of the chairman about the applicant and documents submitted by the applicant and their compliance with applicable regulations. Answers to possible questions, approximately 5 minutes. The applicant's summary report outlining the key points of his study, approximately 15 minutes. Questions to the applicant strictly on his report, no more than 2 minutes for each question. Answers of the applicant, no more than 5 minutes for all answers. 5. Speeches of all the Dissertation Council members in turn, with their assessment of the thesis and the applicant's speech, as well as questions and suggestions to the applicant, approximately 10 minutes for each speaker. 6. Speech of the chairman with his assessment of the dissertation, approximately 10 minutes. Answers of the re-applicant to questions and remarks made by the Dissertation Council members, no more than 20 minutes. 8. Open discussion. Speeches at will of the attendees with summaries of their positions and or specific questions and suggestions to the applicant strictly on the theme of the study, not more than 2 minutes for each speaker. At that, all the speakers are kindly requested to register in the registration sheet and introduce themselves fully before speaking, giving a full name, position, and place of employment. 9. Presentation of questions to the applicant received during the scientific discussion of the dissertation at the university website. Let me inform you that written questions, the presentation of which take more than 2 minutes, shall not be presented. 10. Answers of the applicant, not more than 2 minutes for each question. 11. Speech of the academic supervisor, no more than 3 minutes. 12. Discussion of the Dissertation Council members before open individual voting. For that period, the sound shall be switched off. 13. Open individual voting. Votes shall be counted by the Dissertation Council chairman and results shall be recorded in the minutes. 14. Make a decision on awarding or non-awarding the degree. And 15. Closing remarks of the applicant, no more than 2 minutes. Dear colleagues, do you have any questions or objections to this procedure? No? No, nobody has any questions. If nobody has any objections, let's start the procedure. Please switch off your mobile phones. Dear colleagues, working in the remote mode, please keep your mobile phones on so we could reach you in case of a technical emergency. Thank you for your understanding. Let's start the session. Summary report. The thesis by Mamedov, Ibragim, Gamidulayevich for the degree of Candidate of Medical Sciences, Scientific Specialty 140203, Public Health and Healthcare, on the theme Scientific Justification of Medical and Social Assessment of Health of Male Workers of Shipbuilding and Ship Repair Enterprises, was accepted for defense by the order of Academic Secretary of St. Petersburg University on the 19th October 2021, number 8134/1. Mamedov Ibragim Gamidulayevich wrote his thesis at Astrakhan State Medical University as a postgraduate student. His academic supervisor is Doctor of Medicine, Professor, Head of the Department of Economics and Healthcare Management, Postgraduate Education Course, Astrakhan State Medical University, Shapovalova Marina Alexandrovna. The number of publications which set forth the main scientific results of the thesis, according to the enclosed list, is 13. In peer-reviewed journals from the list approved by the Ministry of Science and Education, Russian Federation, 3 publications. In journals indexed in the scientific databases, Web of Science and Scopus, 2 publications. All the documents submitted by the applicant, according to information received from the curator, comply with the St. Petersburg University requirements and are kept in the applicant's attestation file. Copies are available from the Office of the Dissertation Council Activity Support Department, who is now present. Before I give the floor to the applicant, I have a question for the council members. Dear council members, do you have any general questions to the applicant, and is it necessary to review the entire list of documents submitted by the applicant? No. No. There are no questions. So the applicant's report, 15 minutes. Ibragim Gamidulayevich, the floor is yours. Distinguished Chairman of the Dissertation Council, distinguished members of the Council, let's turn the microphone on. Physical and intellectual abilities, professional skills, motivation to work, development, and self-improvement. At the heart of all, and the above, is his state of health, whose role and place in the life of each individual and the society in general cannot be overestimated. Priority government programs that finance the Russian healthcare include disease prevention, healthy lifestyle promotion, health result treatment, etc. There are many areas for studying health and the factors determining it, and many objects and subjects for studying it, but it's the health of the working age population that comes closest to the material well-being of the society. In view of the high degree of state importance of shipbuilding industry on the one hand and presence of industrial harmfulness of shipbuilders on the other, there was an objective need of the present research aimed at scientific methodological substantiation of the medical social health assessment system for male workers of shipbuilding and ship repair enterprises, contacting with industrial harmfulness for formation of adequate prevention programs. The tasks of the study were social portrait of male workers at shipbuilding and ship repair enterprises in Astrakhan, analysis of morbidity and structure among male workers, identification of determinants that cause the formation of occupation-related diseases and measures for their prevention, construction of a predictive model for disease prevention in male workers, development of a set of adequate preventive measures for male workers in the shipbuilding industry. Provisions put forward for protection. Objective systematic estimation of shipbuilding enterprise workers' morbidity can be built up with the help of medical and social analysis and modeling. Revealing determinants causing information of occupation-related diseases allows to develop adequate preventive measures. the algorithm of estimation of the actual data of mobility of workers of shipbuilding and ship repair enterprises with the identification of factor and result signs can be used for further forecasting. The study was based on data from the Astrakhan Clinical Hospital, of the Federal State Budgetary Institution of Healthcare, of the Southern District Medical Center for the Federal Medical Biological Agency of Russia. The object of the study was male workers of shipbuilding and ship repair enterprises of Astrakhan in contact with occupational hazards. The subject of research was a complex of theoretical, methodological, and practical questions connected with development of an integrated medical social estimation of health of workers of shipbuilding enterprises and contributing to industrial harmfulness. Research hypothesis: the risk of occupation-related diseases is exposed to occupational hazard increases the risk of professional work experience and decreases active introduction of preventive measures. The work was carried out state by state according to a pre-designed program, using traditional methods of information collection depending on the objective and task set. At the first stage, we studied literature on the problem of morbidity and medical and social assessment of effectiveness of medical care for workers of industrial enterprises. At the second stage, we collected statistical data at the Astrakhan branch of the Federal Medical and Biological Agency based on medical records, conjectural and sociological survey of main employees of shipbuilding enterprises in Astrakhan. The third stage involved calculation, assessment, and analysis of mobility indicators and structure. The fourth stage involved determining the formation of occupational diseases and measures to prevent morbidity among male workers of shipbuilding enterprises, as well as the calculation, assessment, and analysis of impact of factors that cause the impact on health indicators of male workers. At the fifth stage, building of predictive model, providing possibility of a preliminary estimation of development diseases and their prevention in applying for medical contacting to industrial harmful factors. Development of a complex of adequate preventive measures for the workers, shipbuilders, was carried out. Statistical method, mathematical modeling, and organizational experiment were used in our work. The object of this study were male employees of ship repair and shipbuilding enterprises of Astrakhan, number of 1,804 receiving medical care at Astrakhan Clinical Hospital. The main centers of Astrakhan shipbuilding and ship repair are Zvezdochka Ship Repair Center and Shipbuilding and Ship Repairing Plant. The specifics of production of activities necessitates in-depth analysis of the sociological profile of employees of these enterprises. We found that the largest share in the structure of enterprise employees was occupied by industrial production personnel. Among the industrial production personnel, the first places were occupied by workers on complex maintenance and repair, electricians and electric welders, turners, and body assemblers, drivers, and engineers. We found that the large proportion of men had more than 20 years of work experience and a smaller proportion had up to 9 years. For industrial and production personnel in the shipbuilding industry, a number of adverse factors have been identified that accompany their work activities, usually of a combined nature. The groups of unfavorable factors included cold microclimate, working with electrical equipment, noise, heavy workload, and insufficient light. Noise, microclimate, uncomfortable forced position, vibration, physical overload, and stress at work. High air temperature, general vibration, occupational noise, physical overload, working at height, contact with synthetic detergents. We found that approximately 82% of respondents actively underwent periodical medical checkups. 75% went to a doctor for preventive care, and 92% followed their doctor's instructions. According to a survey, 80% of respondents observed their daily regime and diet, actively underwent medical checkups, followed their doctor's instructions. 40% practiced physical exercise and sports, sought inpatient care at least once a year and were satisfied with the quality of care provided. According to the results of medical examinations, 62% of employees were classified the first health group, second group 2.8%, third group 31.9%, fourth group 3.5%. As a result of periodic medical checkups and following recommendations according to specialist conclusions, the outcomes of medical and preventive measures taken among employees of shipbuilding and enterprises were assessed. So, among the treated workers, 58% had no changes in their state of health, 39% had an improvement, 2% recovered, and 1% had deterioration. The result of treatment and preventive measures, no change, was due to the presence of defects in the medical and social activity of shipbuilders. The reasons for low effectiveness of therapeutic and preventive measures were non-compliance with the diet, non-participation in medical checkups, failure to consult a doctor for preventive purposes, lack of motivation to engage in physical education and sports, non-compliance and ultimate execution of medical prescriptions, which was confirmed by a close direct correlation of these defects in the medical and social activity of shipbuilders and the lack of changes in their health status. We revealed the statistical significant dynamic increase in morbidity according to preventive medical examinations and data on applications for medical care. These circumstances prompted an in-depth study of morbidity of this population, its structure, causes, and reasons. The diseases mostly include circulatory system, musculoskeletal system, disease of eye and its appendages, diseases of endocrine system, etc. The total hospitalized morbidity rate for male employees of Astrakhan's shipbuilding enterprises had a negative growth trend. The growth of shipbuilders' morbidity occurred both during the time period and in the age intervals of working, considering the correlation analysis revealed direct statistically significant relationship between the frequency of pathology registration and work experience at shipbuilding enterprises. The incidence among workers with more than 20 years of work was significantly higher than among workers with less work experience. The seasonality index indicates the male workers mostly seek medical care in spring and summer at height of work activity and great exposure to aggressive factors at work. The reduction in length of stay in hospital also contributed to a decrease in the proportion of people discharged to work and corresponding increase in proportion discharged to outpatient care. Similar trends persisted in the trainee groups, a decrease in the share of those discharged to work to each subsequent trainee group, which emphasized the significant role of industrial factors and duration of their impact on employees of shipbuilding and ship repair enterprises. In order to analyze the data over time and to identify changes in the number of patient referrals depending on the strength of exposure to adverse occupational factors, correlation plots of the number of patients and occupational factors, a linear regression model was built up to obtain the correlation data. Visualization of the indicators in the form of a graph indicates the presence of a medium strength correlation relationship between the increase in the number of patients and strengthening of such indicators as noise, vibration, cold microclimate, work with electrical installation at the enterprise. Thus, mathematical modeling techniques have been used to identify the four main adverse factors: cold microclimate, working with electrical installations, noise, and vibration. The risk of diseases caused by exposure to these factors have been identified. To reduce the risk of disease occurrence, preventive measures were included in this system for assessing the interaction of patient referrals and negative workplace, and the analytical model was built again. As a result, there was a decrease in correlation coefficient values, as can be seen on this slide. A similar pattern of a 30% reduction in the relationship between negative work factors and workers seeking healthcare was found when the factor a better working condition was added to the model. A medical and social assessment of the health status of male shipbuilding workers has shown occupational risk factors for diseases in male shipbuilders and conditions of their realization: noise, vibration, cold microclimate, working with electrical equipment were identified risk factors. Men over age of 45 interacting with high risk factors were more than 8.5 years are at high risk of disease. Men under 39 years interacting with risk factors for up to 6.6% years of experience. Thus, workers in the shipbuilding industry were classified as industrial and production personnel and were represented by men who had been in contact with occupational hazards as co-factors. According to the results of medical examinations, more than 60% of workers were put in the first health group. Exacerbation of diseases was recorded in 45% of employees. The estimated risk of disease occurrence among shipbuilding industry workers was 0.8, which was due to workers' contact with industrial hazards. The result of treatment and preventive measures, no change, was due to the presence of defects in the medical and social activity of shipbuilders. These reasons for low efficiency of preventive medical measures were non-compliance with the dietary regime, non-participation in medical examination, failure to see a doctor for preventive, non-fulfillment, untimely fulfillment of doctors' prescriptions, lack of motivation for physical training and sports, which was confirmed by close direct correlation between the mentioned defects in the medical and social activity of shipbuilding industry workers and the lack of changes in the health of the workers. Preventive medical examinations revealed a twofold statistically significant increase in morbidity. Total hospitalized morbidity had a negative trend, showing a significant increase. The leading causes of the increased morbidity were diseases of the circulatory system, digestive organs, nervous system, musculoskeletal system, and connective tissue, as the most common caused by exposure to production factors and stress at work. The levels of pathology increased both in the interval studied and from each previous to each subsequent work experience group, with a tendency for the list of causes to increase due to the longer contact with occupational hazards. The increase in morbidity caused an increase in the number of days of temporary incapacity for work. The duration of hospital stays was determined by the standards and determined by the diagnosis, severity of the patient's condition, and effectiveness of treatment. A reduction in the length of hospital stay contributed to a significant reduction in the share of patients discharged to work and a corresponding increase in the share of those discharged for outpatient treatment. Similar trends persisted in the decrease in the share of those discharged to work and increase in the share of those discharged each group, which emphasized the significant role of work factors and the duration of their impact on shipbuilders. Medical treatment was more frequent in spring and summer at the height of industry production and correspondingly more exposure to aggressive production factors. We identified the relation between risk factors at shipbuilding, and aiding preventive activities to further rebuilding of the analytical model significantly reduced the correlation coefficient, reflecting the actual difference between professional hazards and the probability of disease occurrence. In conclusion, I would like to make some practical recommendations when planning preventive measures and routing of shipbuilding industry workers. Healthcare authorities should estimate the duration of work in the profession and the duration of contact with occupational hazards. Given the significant share of shipbuilders discharged to outpatient treatment, it's necessary to control the efficiency of outpatient treatment in the organization of preventive measures. Given the important role of preventive measures in maintaining the health of shipbuilders, healthcare workers should promote healthy lifestyles and demonstrate the importance of prevention in reducing the risk of disease and maintaining health. The primary prevention measures should be used to shipbuilders at risk of developing disease, secondary prevention for those at high risk of developing disease. Thank you for your attention. Thank you, Ibragim Gamidulayevich. Let me ask the council members, do you have any questions about what we have heard? Is there a question? Yes, there is. Dear Ibragim Gamidulayevich, I have one question which I got when reading your thesis, and I saw one chart in your presentation related to this issue, where patients are discharged from hospitals. You indicated that most of them are discharged for outpatient treatment. Could you please tell me what is the main reason for this? Is this required by the institution, like compliance? Is it, or it's because of there are some economic considerations? Please answer. Dear Alexander Leonidovich, here several indications. A low number of workers discharged to work and reduction of hospital stays, diseases turning chronic, and severity and the need for further outpatient treatment. These are the main factors. Thank you. Dear colleagues, do you have any further questions? Olga Vasilyevna, I have a question. Olga Vasilyevna, please. Thank you. Dear Ibragim Gamidulayevich, in the beginning of your presentation, you mentioned such an occupational hazard as synthetic chemical compounds, chemicals, mean paint and varnishes, the professional status, the impact, and you have never mentioned that. What could you say about the design of your study and assessment of the chemical factor? Is the question clear? Yes, it is. Well, if you cannot hear it as properly, dear Olga Vasilyevna, in our study we have identified the main factors. Let me find this. We identified 4 negative factors that affect the health of shipbuilders, and the impact of chemical compounds was not that significant. So we focused on these 4 factors: cold microclimate, working with electrical appliances, noise and vibration. I beg your pardon, but still, in order to confirm the fact that chemical load, that shipbuilders are not exposed to any hazard because of the use of chemical substances, to confirm that factor. Where did you have you come across any chemical factors? Yes, we registered some respiratory diseases among shipbuilders. Yes, we have. But I understand the number was insignificant. Yes. So that's why we focused on the 4 factors listed here. Olga Vasilievna, are you satisfied? Not quite, because in order to exclude a factor, you need to have some reasons. So there some analysis must have been done to say that only a small percentage of shipbuilders are exposed to negative impact because of the use of chemicals. So what criteria for exclusion of this factor did you use? We excluded this factor because of the small number of shipbuilders involved in painting, and how many workers involved in this processes? Not more than 20 workers. So 20 workers is that's really a small number. I see, thank you. Only 20. That's indeed insignificant. Dear colleagues, have more questions? I see. Thank you very much. The speeches of the applicant's speech, or questions they might have. Also, I would like to propose, since all the reviews have been published at the university website and have been available there for a long time, so maybe you will suggest so would you prefer to answer each review individually or answer all the questions in the end? Let me mention that we don't have any external. We have not received any external reviews. That is why. Do you have any objections to my suggestion? We will not to read. Of course, you can also read your entire review or just focus on the key points in your review. Dear colleagues, I would like to give the floor to Alexander Leonidovich Lindenbraten first. Dear Igor Mikhailovich, dear colleagues, I will follow your suggestion not to read the entire review because all the council members submitted their reviews, so we have all read the thesis. So talking about the thesis we are discussing is useless. I will focus on the key points, in my opinion. So first of all, we can't avoid relevance of the subject. And when we talk about the study of health is always relevant. And for me, it's very important that in this thesis, it's not the main goal, the study of health, but that's information provision for management, because the study of health was used as the basis for making decisions aimed at improvement of health. And in my opinion, that is very important. Also, I would like just say that the work, in my opinion, has a traditional setup, has other traditional sections. I will not expand on that. I would like to focus on the following questions, considering the content. So first is the study methodology. It made a positive impression on me. I think it was a good combination of classical or traditional methods, the analytical methods, statistical, sociological methods, etc. And what we come across more and more often is the use of mathematical modeling. So that enables us not only to receive information, but also to process this information and issue specific recommendations and make conclusions, and serves as the basis for practical activities in managing healthcare in a specific region or in specific populations, etc. And in my opinion, this determined the setup of the work, and the author first describes the population, explains what the population is lifestyle, working conditions. Then he describes the health status of this population, considering the statistical data on morbidity, etc. And then we not simply register the situation, we try to understand why it's like this. And here the author very clearly analyzes factors that may affect and change the health of the population under study. And in his report, he mentioned these 4 factors that we need to consider when making decisions. Same mathematical modeling methods enable not only to say that's what we can use in a broad sense, promote healthy lifestyle, introduce prevention, but the use of mathematical modeling, the work evaluates the impact of various measures on solving the task. So this management makes the management more efficient, and in my opinion, it's worth mentioning. And this work, as I read it, I thought it could be used as a sample, as a template. In this work, this work is about one population, shipbuilders, but the algorithm of the study can be the same current status of the object, definition, what factors are at work, and what effects can be achieved. And in my opinion, this work has this universal approach, and it will not be plagiarism in any other study, but that's modern methodology that we should welcome. So that's the work setup. So in that sense, I have no critical remarks to this thesis. I have a fairly high opinion of this thesis. I like the fact that the author does not limit himself to a list of specific measures, because very often in the end some works we find practical recommendations, but the author in the course of his research has evaluated effectiveness of why, but there is specific data on prevention measures, reducing the risk of occupational morbidity. So during the study itself, we started to assess the results that confirm appropriateness of our measures. And as there's all this question, I have already asked one question, because this fact was mentioned in the report. I asked this question for a reason, because I have been watching for some time how the algorithms are changing. So first there is an order we need to follow or something else, and I was always surprised how patients are discharged from hospitals to work, because a patient at a hospital that means he needs constant supervision or patient care, and then today he's in this condition, and then tomorrow he's considered healthy and fit for work. So I think such a change of approach, certainly considering that hospital treatment is more expensive, it should also be economically justified. So, according to a number of styles, you can also see this here. I would like to ask one more question. That's why I mentioned results, because of course in reality we need to look at efficiency. The efficiency is all about the relation between the costs and results achieved. So this work indicates by how much morbidity risk decreases. But what is the economic effect produced by these measures? If the author, the applicant, could answer this question. Dear Alexander Leonidovich, prevention measures are cheaper compared with treatment, and well, that creates an economic effect. Fit worker results in higher performance, and we may also look at taxes, and all these produce only economic effects. But you have not done any specific calculations. The level of economic efficiency in our study was up around 30%. So that's a specific number. The reason I pay attention to that, the famous phrase that it's cheaper to prevent a disease than to treat it, it's not always true. It's not always easier, and it's not always cheaper, because sometimes mass prevention programs we are using, they produce some effects, but the costs are so high that maybe the efficiency, but this study demonstrates that the economic efficiency was there, and on the basis of this I can only give my opinion that the work complies with all the requirements. I don't have any critical remarks, and in principle I'm absolutely satisfied with this work. Alexander Leonidovich, you have to read the final part of your review. The thesis by Mamedov, Ibragim, Gamidulayevich, Scientific Justification of Medical and Social Assessment of Work of Shipbuilders and Ship Repair Workers, is a complete piece of research which contains some new provisions and practically significant results. The work addresses the task of health assessment, significant for public health in shipbuilding and ship repair enterprises in Astrakhan region for prevention measures. For its relevance, novelty, methodology, the thesis by Mamedov Ibragim Gamidulayevich corresponds with the main requirements set by the order of St. Petersburg University on the 1st of September 2016, number 6821/1, on awarding academic degrees at St. Petersburg University. And the degree applicant deserves awarding the degree of Candidate of Medical Sciences, specialty 140203, Public Health and Healthcare. Articles 9 and 11 of the above-mentioned order has not been violated. Thank you. Alexander Leonidovich, thank you very much. Now I'd like to give the floor to Mironenko Olga Vasilyevna. Dear Igor Mikhailovich, dear council members, let me not read my entire review. I will just focus only on the key points. Of course, the relevance of this work, which is dedicated to health assessment of shipbuilders, is beyond any doubt. The work is very well designed, sufficient number of publications. All the conclusions are justified, scientific novelty and practical significance explained by evidenced by implementation of the results are also beyond any doubt, and that is why let me say that the critical remarks mostly of editorial nature, and I would like to ask the applicant some questions to Ibragim Gamidulayevich. I have 3 questions. I would like Ibragim Gamidulayevich to give a detailed description of the predictive model and how does it interact with a degree of exposure to occupational hazards. That's my first question. Second, what measures of disease prevention were applied earlier in this industry in the past, and what do you suggest? And please evaluate their effectiveness of compared with earlier measures. And finally, please characterize the occupational diseases in the shipbuilding industry and the level of detection, if you have done it. Please answer questions of Olga Vasilyevna. Dear Olga Vasilyevna, in my study, the development and use of a predictive model on our data allowed us to obtain immediate results from the proposed measures without expecting promising results from the application of preventive measures. For the purpose of mathematical assessment of influence of medical, social, and industrial measures on shipbuilders' health, we carried out the predictive analysis and formed the predictive model. At the initial stage, a sample of occupational adverse factors was selected. Then, on the basis of factors, we constructed a scatter diagram. So, as a result, four main negative factors were identified. After analyzing the patients and processing the data on adverse factors, risk groups were identified. This allowed us to divide the patients into two categories: those with high and low risk of occupational pathology. Based on the data we obtained, a primitive prediction model for new patient was created. On the basis of this information, we can predict the risk of particular specific diseases in new patients, and then on the basis of information we performed a more in-depth analysis to create a more in-depth prediction model. At that, as a relation between the number of patients and the number of negative factors, and to reduce morbidity, the assessment system included preventive measures and better working conditions, which result in a significant reduction in the correlation coefficients. As for the second question, the main measures used in shipbuilding industry are preliminary and periodical medical checkups, development of healthy lifestyle involving workers in physical activities and sports, work and food regimes, preventive medical treatment, and target-oriented measures. So we assessed health of shipbuilders, and in low-risk patients, effective measures are rational diet, compliance with the work-rest schedule, training workers in medical knowledge, implementation in the principle of time protection, creation of safe working environment, and 1 or 2 courses of therapy. For patients with high risk of morbidity, lower the risk, we suggest prevent outpatient treatment, inpatient treatment, medical rehabilitation, sanatorium treatment. The application of this model reduces the risk of occupational diseases by 25-30% and also reduces the dependence of morbidity on work factors. And for professional diseases of shipbuilders were caused by production peculiarities, such as working in confined spaces with high level of air pollution, working in open air, exposed to strong winds, atmospheric pressure, temperature, vibration, and working in uncomfortable poses. Among chronic diseases, the most common are cardiovascular, of muscular skeletal system, gastrointestinal, ENT, and eye diseases. Most diseases we came across during our study and the course of our study related to professionally induced diseases. Olga Vasilyevna, are you satisfied? Dear colleagues, earlier, before, so these measures, the prevention measures, have they been taken by the enterprises? Is this what about prevention measures before? Prevention measures. Dear Igor Mikhailovich, yes, such activities were conducted, but the scope was limited. And in addition, we suggest to improve the working condition, and while the combination of these measures can produce such results. So working conditions, we suggest to the employers to do this. Olga Vasilyevna, you've heard the answer. Yes. In principle, I'm satisfied with the answers of Ibragim Gamidulayevich to my question, but I understand he doesn't have any figures, but like numerical, there's no information on numerical assessment and of the economic effect. I understand that was not the purpose of this study. Yes, that's right. Thank you, Olga Vasilyevna. Please give your final verdict. So thus, let me conclude on the thesis by Mamedov, Ibragim, Gamidulayevich on scientific justification of medical and social assessment of health of male workers of shipbuilding and ship repair enterprises, which is a complete scientific paper, contains important scientific task of health assessment in male workers in specific industries in Astrakhan region for prevention measures that would exclude occupational hazards, which has great scientific and practical significance. The thesis by Mamedov and Gamidulayevich, scientific justification of medical social assessment of male workers of shipbuilding and ship repair enterprises, complies with the main requirements set by the order of St. Petersburg University on the 1st of September 2019, 6821/1, on the order of awarding academic degrees at St. Petersburg University. And the degree applicant deserves to be awarded the degree of candidate of medical sciences, specialty 140203, public health and healthcare. Articles 9 and 11 of the above mentioned order has not been violated by the author. Thank you for your attention. Thank you, Olga Vasilyevna. I am pleased to give the floor to Savina Nadezhda Valerievna. Your review, please. Dear Igor Mikhailovich, dear council members, I'm not going to read my entire review, since it has been published in advance, and my colleagues already made my job easier. They have already explained how the thesis is organized and at what attention should be paid. I'd also like to say that the study of health of shipbuilders is of strategic importance for public health and sustainability of the state, and they have great potential for the economic development of the entire region. Dear colleagues, let me mention the scientific novelty of this research. The author obtained new data on the basis of a study of health of shipbuilders in Astrakhan. The author studied morbidity and its structure in male workers, identified the factors, professional risks, and on the basis of the predictive model of preventive measures for male shipbuilders was created, and a set of preventive measures was created for working age population. I'd like to draw your attention to practical significance of this study, because of the analysis, the study conducted, the preventive measures were used to provide practical recommendations for male workers of shipbuilding enterprises and ship repair enterprises. And yet, I'd like to say that when studying literature, there's a great number of sources, not only on the health of shipbuilders, but but other sources as well. But that fact does not reduce the overall positive assessment of the work. When reviewing the thesis, I got several questions to which the degree applicant has already answered. But let me ask one question, but since the applicant has already answered, I would like to ask the predictive model. Your model can be proposed for use, or is it already being used in organization management model? Please answer, Nadezhda Valerievna. Dear Nadezhda Valerievna, the predictive model we have already used as a tool for further development of the management model and assessment of the impact of medical factors on enterprises. So it has already been used. Thank you very much. Well, considering the results and the number of publications, the degree applicant has published in 3 journals recommended by the Russian Ministry, 2 articles published in Web of Science, indexed in the scientometric database Web of Science. And in conclusion, I'd like to say that the thesis by Mamedov, Ibragim, Gamidulayevich on the theme Scientific Justification of Medical Social Assessment of Health of Male Workers of Shipbuilding and Ship Repair Enterprises complies with the main requirements set by the order of St. Petersburg University on the 1st of September 2016, number 6821/1, on the order of awarding academic degrees at St. Petersburg University, and the degree applicant deserves being awarded the degree of candidate of medical sciences, scientific specialty 140203, public health and healthcare. Articles 9 and 11 of the above-mentioned order has not been violated. Thank you. Thank you very much, Nadezhda Valerievna. Now I am very pleased to give the floor to Dmitry Olegovich Meshkov, Well, Dmitry Olegovich, please present your review. Thank you very much. Unfortunately, I was not able to attend. The pandemic is made the change my plans, but reading I very much enjoyed reading this thesis. And if we talk about what made the greatest impact, two positive factors connected with this thesis. This is one out of few works that looks at restoration of professional resources as an important factor, goal of the healthcare system. Here we are getting back to this understanding of health, which is not only a public value, but an important factor for the economic development of the state. And so maybe the terminology is incorrect, such as return on investment, too many economical terms, but I think the topic is very relevant, and asking the especially applying it to the employees in shipbuilding industry, it brings the tasks addressed by the author to reality, and the current status of the shipbuilding industry of the state, and they can be a good example, an algorithm or template mentioned already that could be used in other industries as well, which in my opinion is very good strong point of the thesis. And second thing I want to emphasize is the correct use of mathematical modeling. Unfortunately, many papers I had to come across dedicated to health protection, they don't use the mathematical methods properly, though of course the situation is changing, and the thesis we have reviewed at this council, they have this positive characteristic. On the other hand, the works in mathematics produced by mathematicians on organization of healthcare, unfortunately, they do not consider the nature of this industry, and the mathematical instruments is far from reality. In this work, the author was able to combine both, which I think is a very strong asset of this work. Speaking of drawbacks, of all the significant drawbacks that I would like to mention, or where I would like to ask any questions, I don't have in all the answers to all the questions I got, I found in the thesis itself, which I think is a good strong point. So let me, following the procedure, just say what I have to say. The documents are available at the council, and I will just read my opinion have on paper. The thesis by Mamedov, Ibragim, Gamidulayevich on the theme scientific justification of medical social assessment of health of male workers of shipbuilding, ship repair enterprises complies with the key requirements set by the order of the 1st of September 2016, 6821/1 on awarding academic degrees at St. Petersburg University. And the degree applicant Mamedov Ibragim Gamidulayevich deserves being awarded the degree of Candidate of Medical Sciences, specialty 140203, Public Health and Healthcare. Articles 9 and 11 of the above-mentioned order has not been violated by the author. Well, thank you, Dmitry Olegovich, and I would like to give the floor with pleasure our foreign council member, Andrei Mecheslavich Grishkovsky. Thank you for being with us. Microphone, please. Thank you for this reminder, dear Igor Mikhailovich, dear council members. So first of all, let me thank you for the opportunity to read this work. To be part as somebody born there in Severodvinsk, and my parents work at shipbuilding enterprises, so I was had some personal attitude as well. What caught my attention is these are same things that caught attention everybody else: the use of the prediction model and the use of mathematical modeling. That's what I teach. And today I delivered 2 lectures in mathematical modeling, and so it was very interesting to use this model. This model can be used to create new models. As a mathematical model is good after its efficiency has been proved, and about this model has already been mentioned, and many good words have already been said, so I won't repeat what has already been said. It's interesting that we all have said many good words about the model, but I have never found in the text where the author suggested to use it. On the one hand is suspicious, but on the other hand, the use of the same model based only on data from one study, maybe that it's premature. We need to see how efficient it is in the future. So that's an elegant solution. So we looked at the data, we saw its characteristics, but let's use what we have. So I was very pleased to read this, and the author has a very sound understanding and is not overjoyed by the use of mathematical instruments. I also got a number of questions to the author. For example, we discussed prevention activities, but how? Let me read. How can we control such enterprises as at the outpatient level of the healthcare system? This is my first question. And before I ask my second question, maybe it will be interesting to hear the answer. Well, please answer the first question. Dear Andrei Mecheslavovich, control of preventive measures at the outpatient level can be exercised on the basis of periodic medical checkups. This can be done by outpatient clinic doctors and shop floor doctors. And the next question? And yes. And my satisfaction will depend on the answer to the second question. We spoke about inefficiency or low efficiency. Alexander Leonidovich has already discussed. So still I would like to clarify. What is the reason for such low efficiency of medical preventive measures for shipbuilders studied by the author? please answer. The low efficiency of conducted measures is determined by non-compliance of the diet, withdrawal from medical checkups, non-compliance with the doctor's prescriptions, lack of motivation for doing sports. So all these reasons were confirmed by direct connection, immediate connection between the specific defects in the medical social activity and an absence of changes in their health status. Thank you, Andrei Mycheslavich. So what is your answer? I am terrified by this portrait of a male shipbuilder. But in general, the thesis leaves a good impression. I don't have any critical comments. So of course there's a lot to discuss, and I'd be happy to discuss that if we were able to meet in person. It would be interesting to look at this prediction model. I have some suggestions that are outside the scope of our today's session, so I will just proceed to the conclusion. To say that the thesis by Mamedov, Ibragim, and Gamidulayevich, scientific justification of the medical social assessment of health of male workers of shipbuilding and ship repair enterprises, complies with the main requirements set by the St. Petersburg University Order on the 1st of September 2016, number 6821/1, on awarding academic degrees at St. Petersburg State University. And the applicant deserves, being awarded, the degree of candidate of medical sciences, specialty 140203, public health and healthcare. Articles 9 and 11 of the above-mentioned order has not been violated by the author. Andrei Mycheslavich, thank you very much for your review. And now finally it's my turn. And since all the council members are highly skilled and distinguished scholars, they have perfectly outlined everything. I will just say what after I listened to all the reviewers. The work indeed is extremely relevant, because it's been a while since I personally saw any papers dedicated to the health of industrial workers, male workers. I remember my candidate's thesis was dedicated to health of workers in another industry, but I understand very well the tasks of this work, because indeed it's extremely relevant. And in my opinion, why is that? We have discussed that recently. The employer, what is his role in this entire process? While medics, so this is seldom it took me 2 hours, and indeed the methodology is so beautifully written, is very clearly logically organized. But I've got immediately some questions. What about the employers? Why are employers so passive? Because look at what we've got. Medics report consequences of this occupational risks. They are trying to deal with them, but employers, as medics the engineers had to listen to doctors in the past, because that was required by the government. The employer has to take measures and react upon recommendations of the doctors. So now this practice is gone, but we certainly should bring it back, because if we don't do that, the entire population of male shipbuilders or male workers will die out. And I remembered Vladimir Lenin, who said that first of all we need to remember history, We have to save, to protect health of the workers. Otherwise, the state will collapse. Even the virus, the pandemic, has demonstrated that finally health can immediately affect the economics. So it seems like every cloud has a silver lining. The entire society was able to see the role of medics and managers. You said it very well, that the impact of medical measures have direct impact on GDP. So the measures suggested, maybe they should be forwarded not only to medics but to the entire industry. So maybe a letter should be written based on the results. I'm so glad we are discussing this work, but I think we can, and as if factors professional, such as professional risks, they seem to be occupational, but for specific workers, for specific shipbuilders, they are professional factors. So these are it's a professional factor, and we should make employers pay attention to these factors. So I think the work is very interesting, it's highly relevant, it evokes many interesting ideas, and because we would like to see what's next. So from the point of methodology, I agree. So the work should be used as a template for some postgraduate students. I have a student who's working on her thesis for a long time, and the way this thesis is arranged, maybe that's the work idea is so well organized. This must be the achievement of the scientific supervisor, and since I have all the questions I had have already been answered, so I just proceed to the conclusion. So the thesis by Mamedov, Ibragim, Gamidulayevich, scientific justification of medical social assessment of male workers, complies with the main requirements set by the order of St. Petersburg University on the 1st of September 2016, number 6821/1, on the order of awarding academic degrees at St. Petersburg University, and the degree applicant deserves being awarded the degree of candidate of medicine, scientific specialty 140203, public health and healthcare. Articles 9 and 11 of the above mentioned order has not been violated. So, dear council members, are you satisfied with the answers given by Ibragim Gamidulayevich, or would you like to add something? No. Dear colleagues, are you all satisfied with the answers? Would you like to add something? No, there's nothing. Thank you very much. Thank you. According to our procedure, now we can give the floor to the attendees. Is any of the attendees willing to speak? No. Thank you. Next, according to the procedure, I have to present questions sent to our council website during the broadcast. At this point, we have not received any questions. So then we are done with this phase. Next, I am very pleased to give the floor to the academic supervisor. Dear Marina Alexandrovna, please say a few words about the applicant. Let's use the microphone over there. dear Chairman of the Dissertation Council, dear Council members, dear attendees, let me say a couple of words about the applicant. Considering everything already mentioned, we can see that he has followed his goal, worked towards his goal. He got enrolled in the Astrakhan Medical Academy, graduated the Saratov Medical Military University, and whoever's interested in military sphere, they are transferred to Saratov. So he got transferred to Saratov. He got training, got trained in surgery, worked as a surgeon, but it was necessary for him to improve his managerial skills. And since year 2009, he started to study our sphere, public health, first within the framework of a professional training program, and then he got a second education, management in healthcare, sphere of healthcare, and in 2016 he came to Astrakhan and took up a remote doctoral course in Astrakhan. Since we have such regional industry, which is the cornerstone for our region, he took up this issue. He's very goal-oriented, very polite, very hardworking. That's how I would describe the author of the applicant. Thank you, Marina Alexandrovna. Dear colleagues, would anyone like to add something? Dear attendees, is anybody willing to say something? Is anybody willing to speak? Then, dear colleagues, everything is clear. If nobody is willing to speak, then the discussion is over. No more questions shall be accepted. Before we sum up and vote, I have to ask all the council members and the applicant if council members and the applicant have any comments regarding the procedure of this session, including any comments regarding the remote access mode. Each council member has to answer no. Olga Vasilyevna, do you have any comments regarding the procedure? No. Dear Igor Mikhailovich, I don't have any comments. Nadezhda Valerievna, do you have any comments to the procedure? Professor Savina has no comments. Thank you. Dmitry Olegovich, do you have any comments? No, I don't have any comments to the procedure. Andrei Vyacheslamovich, you have any comments? No, I don't have any comments. I don't have any comments either. That's why the next item is voting. Is it necessary to take a technical break to discuss the results? No. If we decide not to take a break and we don't need any time for a private discussion, let us proceed to voting. We can all see and hear each other well. We can all see and hear each other. I see the answer was no. I put the question of awarding to Mamedov Ibragim Gamidulayevich the degree of Candidate of Medical Sciences, Scientific Specialty 140203, Public Health and Healthcare, to open individual voting. Let me emphasize that voting for each council member agrees that Article 11 of the order has not been violated, and let me remind you, the thesis, the applicant shall be obliged to refer to the author and or the source of borrowing materials or individual results. When using in the thesis the results of scientific works performed by the applicant and or in co-authorship, the applicant is obliged to indicate this fact in his thesis. Let me remind you that the decision of the Dissertation Council on awarding a degree shall be considered positive if over a half, but not less than 3 members of the Council present have voted for it, according to Article 17 of the Order on the Dissertation Council thesis and the St. Petersburg University. This is Annex 2 to the Order of the dated the 1st of September, number 6821/1. Well, Council Member Linden Bratton Alexander Leonidovich, your opinion? I am for awarding. Thank you very much. Council Member Mironinka Olga Vasilovna, your opinion? I am for awarding the degree. Council Member Savina Nadezhda Valeriyevna, your opinion? Yes? I support. Council Member Mishkov Dmitry Olegovich, your opinion? Yes, I support. Thank you. Council Member Grozhibovsky Andrei Mycheslavich, your opinion? I am for. And my opinion is also for. Thus, counting the votes and announcing the results, 6 members voted for, nobody voted against, and nobody abstained. A decision to award to Mamedov Ibragim Gamidulayevich the degree of Candidate of Medical Sciences in Scientific Specialty 140203, Public Health and Healthcare, has been made. Congratulations, and you have the floor for your closing remarks. Dear Chairman, dear Igor Mikhailovich, thank you for giving the floor to me. I am very grateful to God Almighty for today. I would like to thank my scientific supervisor, Professor Marina Alexandrovna Shapovalova, and our entire team, Marina Alexandrovna Kashkarova, who all this time guided, supported me, and with their work, with their honest assessment, brought me to where I am today. I'm very grateful. I would like to thank the administration of Astrakhan State Medical University for the opportunity to work as a doctoral student, to work with our entire team. I am grateful to the administration of St. Petersburg University, the department head of the department, for the opportunity to defend my thesis I'd like to thank all the council members for agreeing and for the work they have done, for honest approach and assessment. I'd like to thank the entire team who worked on this thesis, on those who prepared this session. I'd like to thank my family who bore with me, who supported me, they followed me, and this work I would like, of course, to dedicate to my mother, Serfina Gamidovna, who played a key role, a major role in my career as a medical doctor, who insisted and who's impatient to hear your decision. Thank you very much. Thank you very much. So your speech is over, I understand? I'm very excited, but thank you very much, everybody. And I would like to congratulate all of us on completing this work. Dear Ibragim Gamidulayevich, all the council members, we are happy to congratulate you, and we wish you success. We wish you speak on behalf. Let me speak on behalf of everybody. We wish you. We hope you will continue your research. You have some the potential for this. Hopefully, you can find time. It's very important to find the right supervisor. Thank you for coming to our council to present your thesis. Our rector, Nikolai Mikhailovich Kropotchev, established this council first time, and with the help of such excellent papers, our council can live and develop. Thank you for technical support officers who managed to, and to the translator. Everything was very well organized and professionally done. Thank you very much. I declare the session over. Hopefully, hope to see you again. Thank you and goodbye.